Urinary tract infections, or UTIs, are incredibly common, affecting millions worldwide. These infections can cause significant discomfort and, if left untreated, can lead to more serious health complications. They occur when bacteria, typically from the gut, enter the urinary tract and cause an infection. The most common culprit is Escherichia coli, a type of bacteria that normally lives in the intestines. While often associated with women, UTIs can affect anyone, regardless of gender. Women are more prone to these infections due to their shorter urethra, which allows bacteria easier access to the bladder. However, men experience UTIs less frequently. This is partly because the male urethra is longer, making it more difficult for bacteria to reach the bladder. When they do, the infections tend to be more severe and challenging to treat. This is because the bacteria can travel to the prostate gland, causing prostatitis, which is a more complicated condition. This disparity arises from a complex interplay of anatomical, physiological and microbiological factors unique to men. The male urinary system structure, including the prostate, plays a significant role in the severity and complexity of UTIs in men. This essay delves into the reasons behind the increased severity of UTIs in men, exploring the anatomical differences, physiological considerations and microbiological factors that contribute to this phenomenon. Understanding these factors is crucial for developing effective treatment strategies. We'll examine how these infections differ between genders and discuss the implications for treatment and management. By comparing the male and female urinary systems, we can better understand why men are less frequently affected but face more severe consequences when they are. This knowledge can help healthcare providers tailor their approaches to treating UTIs in men, ensuring better outcomes and reducing the risk of complications. Please subscribe now to join our community. Give a thumb to encourage us to bring more interesting, challenging and high-quality videos to everyone. Our channel, Medicine Health 360, has many more videos to bring the crucial, latest and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We value your feedback, so share your thoughts and help us improve. One of the most significant differences lies in the anatomy of the urinary tract. The urinary tract is a complex system that includes the kidneys, ureters, bladder and urethra. Each part plays a vital role in the process of removing waste from the body. Women have a shorter urethra, the tube that carries urine from the bladder out of the body, compared to men. This anatomical difference is crucial because it influences the susceptibility to infections. The female urethra is approximately 1.5 inches long, while the male urethra can be about 8 inches in length. This shorter length makes it easier for bacteria to travel from the outside to the bladder, increasing the likelihood of infection. Bacteria such as E. coli can quickly ascend the female urethra, leading to urinary tract infections, UTIs. Women are more prone to UTIs, especially after activities like sexual intercourse or improper wiping after using the toilet. Conversely, the male urethra is significantly longer, providing a greater physical barrier against bacterial invasion. This longer pathway means that bacteria have a more challenging journey to reach the bladder, reducing the frequency of infections in men. However, this anatomical advantage comes with a trade-off. The complexity of the male urinary tract can lead to other issues, such as difficulties in urination and increased risk of certain conditions. Men have a prostate gland, a walnut-sized structure located just below the bladder that surrounds the urethra. The prostate is essential for reproductive health as it produces seminal fluid, which nourishes and transports sperm. The prostate plays a crucial role in reproductive health but can also become enlarged with age, potentially obstructing urine flow and increasing the risk of UTIs. Benign prostatic hyperplasia, BPH, is a common condition in older men where the prostate enlarges and compresses the urethra, making urination difficult. This obstruction can trap bacteria, making it difficult for the body to flush them out naturally. When urine flow is obstructed, it creates a stagnant environment where bacteria can thrive, leading to infections. Regular checkups and monitoring prostate health are essential for preventing complications. Physiological factors also contribute to the difference in UTI severity between men and women. The anatomical differences between male and female urinary tracts play a significant role, but hormones are also a crucial factor. Hormones, particularly estrogen in women and testosterone in men, play a role in urinary tract health. These hormones influence various bodily functions, including the immune response and the integrity of the urinary tract lining. Estrogen, primarily produced by the ovaries, helps maintain the health of the lining of the urethra and bladder, making it more resistant to bacterial attachment. This hormone supports the growth of healthy cells and maintains the elasticity and strength of the urinary tract tissues. As women age and experience menopause, estrogen levels decline, potentially increasing their susceptibility to UTIs. The reduction in estrogen can lead to thinning and weakening of the urinary tract lining, making it easier for bacteria to invade and cause infections. While men also experience hormonal changes with age, testosterone does not offer the same protective benefits as estrogen. Testosterone levels gradually decrease in men as they age, but this decline does not significantly impact the urinary tract's defense mechanisms. Additionally, as men age, their prostate gland tends to enlarge, a condition known as benign prostatic hyperplasia, which can lead to urinary retention and increase the risk of UTIs. The enlarged prostate can obstruct the flow of urine, creating an environment where bacteria can thrive and cause infections. Hormone replacement therapy, HRT, is sometimes used to manage the symptoms of menopause and may help reduce the risk of UTIs in postmenopausal women by restoring estrogen levels. However, HRT is not suitable for everyone and should be discussed with a healthcare provider. For both men and women, maintaining a healthy lifestyle, including regular exercise, a balanced diet and staying hydrated, can support hormonal balance and overall urinary tract health. These lifestyle choices can help mitigate some of the risks associated with hormonal changes and aging. Understanding the role of hormones in urinary tract health is essential for managing and preventing UTIs, especially as we age. By recognizing the impact of hormonal changes and taking proactive steps, we can better protect our urinary health and overall well-being. The types of bacteria commonly responsible for UTIs also differ between genders. While Escherichia coli, or E. coli, is the most common culprit in both men and women, other bacteria such as Proteus and Klebsiella species are more frequently implicated in male UTIs. These bacteria are often more resistant to antibiotics, making treatment more challenging. This resistance stems from various factors, including the overuse and misuse of antibiotics, which can create an environment where resistant strains thrive. Moreover, the anatomical complexities of the male urinary tract, particularly in cases of prostate enlargement, can create pockets where bacteria can persist even in the presence of antibiotics, further fueling resistance. UTIs are broadly categorized as uncomplicated or complicated. Uncomplicated UTIs typically affect otherwise healthy individuals and are easier to treat. Complicated UTIs, on the other hand, occur in people with underlying health conditions or anatomical abnormalities that make treatment more challenging. Men are more likely to experience complicated UTIs due to factors like prostate enlargement, urinary tract obstructions, and the presence of indwelling catheters, which provide a direct route for bacteria to enter the bladder. These complications can lead to more severe infections, including pyelonephritis, a kidney infection, and urosepsis, a life-threatening condition where the infection spreads to the bloodstream. Urological factors, particularly those related to the prostate, play a significant role in the severity of male UTIs. As mentioned earlier, BPH is a common condition in older men, causing the prostate to enlarge and potentially obstruct urine flow. This obstruction can create a breeding ground for bacteria, increasing the risk of recurrent UTIs and complications. Other urological conditions such as prostate cancer, bladder stones and urethral strictures or narrowing of the urethra can also contribute to urinary retention and increase the likelihood of UTIs. These conditions often require specialized urological care and interventions to address the underlying issue and prevent recurrent infections.